Hello everybody, my name is Jeff Johnson. Tonight I'm going to talk to you about sleep apnea a little bit. I'm sure at one point or another we've all slept next to somebody or attempted to somebody who was doing this, snoring like a freight train. Or perhaps you've even slept next to somebody who completely stopped breathing altogether and you spent the entire night staring at their chest, making sure it was going to move, or even counting the seconds between each breath, hoping that they were going to wake up earlier in the morning. If you said no to any of these scenarios, there's probably a pretty good chance you're the one with sleep apnea. So sleep apnea can affect anyone and pretty much does affect everybody at some point or another in their life, whether it's directly as a patient or somebody in their family. Today, I'm going to tell you a few about the basics of sleep apnea, how you find out, get diagnosed with sleep apnea, and also how to live with it and how to treat it. I've been a respiratory therapist for several years now. I've spent a lot of time educating patients who were newly diagnosed with sleep apnea on how they were going to do those things. Explaining to them their test results, explaining to them why they had to wear a CPAP, why they had to wear whatever device, and what it was going to do and the benefits of it. Sleep apnea basically is the stopping breathing. It's as plain and simple as it is. Apnea, no breathing. There are three types of sleep apnea. Obstructive, which is the majority of anybody. Obstructive is a physiological defect of some sort or another. It's either going to be obese with a large neck. It's going to be, you still have tonsils and maybe they're large. You have a tongue that's large, rolled back into your throat, floppy tissue. Some people are just born with an airway that's just shaped weird, and if you sleep on your back, you stop breathing. The second kind is called central, which is neurological. Your brain just goes, you don't need to sleep, or you don't need to breathe, so hold your breath. And that's scary, because your brain, how do you treat that? If your brain says that everything's going all copacetic, and all of a sudden you just start holding your breath in the middle of the night, hopefully somebody's there to give you a little kick and wake you up. And then the third one's called complex, which is the combination of the two, which is extremely dangerous and very deadly because not only do you have a physical problem, you also have a neurological problem, and now you have to figure out how you're going to treat that. How do you figure out if you have sleep apnea? Well, there's a few very basic signs and symptoms that you can look for that can lead you to the direction. Do you get 5, 6, 7 hours of sleep and still feel completely drained all day long? Do you doze off while you're driving? Fatigue, want to take naps all the time? Do you snore? Snoring is just an obvious way to get to it. Once you notice those things, go to your doctor, tell them what's going on. They can look for a more clinical thing, high blood pressure, the low oxygen saturation of blood, thing like that. If he agrees with you that there may be a problem, he can prescribe you to go have a sleep study. Sleep studies are very simple, but there's two ways to do them. You can do them in your home, which is a relatively new way to do it, very non-invasive, and you can just go to sleep, wear pulse ox on your finger to monitor your oxygen, something around your chest, and a cannula that just measures if you stop breathing. The machine records the time of how long you've slept, and it just comes up with a guesstimate on how many times you may have stopped breathing. It's effective, but it's not the best way to go. The most complete way to go is in a sleep lab in a hospital, monitored by a respiratory therapist for the entire time that you sleep. We hook you up with all kinds of electrodes, stuff around your head, everywhere, around your eyes, your jaw, your chest, your arms. We're looking for muscle twitch, everything to monitor as you fade into every round of sleep from stage 1, 2, 3. We can watch for everything. And we have you on camera, but we're not watching you sleep unless there's some sort of restless leg or something like that going on, but we're watching the wave patterns. So it's very, very complete, very, very diagnostic, and it's the real only way to get an actual answer on if you have sleep apnea and how severe it is. Now, once we diagnose how severe your sleep apnea is, that's going to be what's going to decide how your treatment's going to be. Most people go with a CPAP. Most people probably know what a CPAP is. If you don't, small device, about the size of a couple loaves of bread next to each other at the most. And it sits on your nightstand, and it's just a big fan. And it just forces air through a tube into a mask, which can either cover your nose and your mouth, It can cover just your nose, or it can have these little pillows that sit up in your nostril. Depending on the patient and what their needs are, sometimes they can be very invasive, big and bulky, and nobody cares, or they can be very lightweight and small, might need a chin strap, something to keep any kind of leak from that pressure getting out. If the pressure gets out, the whole thing is there's no point. CPAP is the only way to really eliminate the entire process of not breathing. For people with more mild symptoms, you can get a mouthpiece. It's called an oral mandibular device. It just looks like a mouth guard you would wear if you were playing sports or anything like that. And it pulls the jaw forward and pulls the tongue out of the way so that it eliminates some apneas, but not all apneas. So hopefully it's enough that you can still get a good night's sleep and feel the benefits of it. And then finally, there are a couple other things where they might just say, hey, you know what, if you lose 50 pounds, you might be good to go. And then there's a surgical route called a UPPP where they do some carving in your upper palate and your uvula. That way, if your tongue does fall back, or if you do have the floppy tissue, it's still a patent airway where you can still breathe. So that's really all the time I have to tell you about sleep apnea. It's a vast thing to go about into. If anybody has any questions, I'd be more than glad to answer them. But I hope I helped you understand a little bit better about what sleep apnea is, how to find out if you have it, and then again, how to live with it. Thanks for your time.